Measles cases are on the rise across the country. So far, according to the CDC, there are a total of 64 cases in 17 states.
Yeah, Colorado has yet to report a case. And joining us now is 9 News health expert Dr. Payal Kohli. Dr. Kohli, good morning.
Good morning.
Good morning.
Okay, hasn't measles been eliminated from the states? At least that's what we were thinking.
Yeah, in 2000, the United States had said measles is eliminated. And what that means is we've had 12 months without a single reported measles case. But really, the pandemic has set off a domino effect. And because of all the things that happened during the pandemic, it's made a comeback. So for the last several years, we've had year after year with measles cases here in the United States.
Now, most of these cases, it seems, are coming from out of the country. So why are we seeing an increase in cases here?
You know, a huge part of that is the fact that people are not getting vaccinated. There's a great amount of vaccine fatigue after the pandemic. And generally, when you get a measles vaccine, it's, done at the age of 1 and the age of 4, and you're sort of immune for life. But on top of that, a lot of states have dropped the requirement for kids to get into kindergarten for them to have an updated MMR vaccine. So both of those things combined, and the fact that a lot of people are now traveling to areas where measles is endemic, because worldwide this is a problem, has caused a surge here. Now, what health experts are worried about is that if it keeps happening year after year after year, is it going to start to become endemic, just like the coronavirus has back here in the United States? And that's where we're really urging people to get vaccinated.
So because, of course, we didn't think that measles was a problem, I don't think too many people are even aware of what the signs and symptoms are to look out for. Can you help us out there?
Yeah, it's funny. I've seen one case in medical school. My brother had measles when he was 10 months old before he was eligible for the vaccine. And that's really been my only exposure, no pun intended, to the measles virus, because it was so uncommon. So essentially it's the 3 C's: cough, coryza, which is sort of inflammation of the airways, the nose, the throat, and then conjunctivitis or pink eye. Now, you can also get a rash, you can get a very high fever, but what we worry about most with measles is that after it sort of starts to manifest itself almost like a cold with a rash and maybe a high fever, you can start to get pneumonia, and some people will progress to get encephalitis, which is inflammation of the brain itself, which is a life-threatening complication. So measles, both in kids and in healthy adults, is a deadly virus.
So we know there's a vaccine, but are there other preventative measures that we can take to prevent this?
Yeah, so if you've gotten the vaccine, single dose gives you 93% protection. 2 doses give you 97% protection. There's also this phenomena with measles, very well defined, called herd immunity, which means if you're part of a group that's largely vaccinated, 95% or more people are vaccinated, you will be protected. But it's highly contagious, as you said. It lasts on surfaces. So the hand hygiene, covering your coughs because it's spread through those respiratory droplets, and just making sure when you're touching public surfaces and such, you're not touching your face after, can be effective measures as well.
Now, of course, you were talking about the fact that we have seen the requirements change to have this vaccination going into kindergarten. But if you're, of my generation or kind of anywhere in between, most of us got this, which is why we've never even thought about this before.
That's exactly right. So most adults walking around have gotten the MMR, both kind of doses in the series of it at age 1 and age 4, sometime around that. If you're not sure, you can easily check a titer. You can check a blood test and see if you have antibodies or not. If you've only gotten 1 dose, or if you lived somewhere abroad, you're not sure about it, I would talk to your doctor, because it's here now.
Right.
And one of the best things that we can do to protect ourselves and our children is to get that vaccine.
And once you get it, you're good.
Once you get it, you're good. You don't have to worry about a booster for the rest of your life. Now, it is a live virus, and so pregnant women shouldn't get it. Anyone who's immunocompromised shouldn't get it. So there's certain groups that can't get it, which is why it behooves the rest of us who can get it to really create that herd immunity to protect all of those around us.
Can you still get measles if you have the vaccine?
You can, but it's a very low probability.
Okay.
So 97% protection, so less than 3% chance that you'll get it. Now, little kids who are not yet eligible for the vaccine, because you can't get it if you're an infant under the age of 6 months, you're not eligible. That's another group we want to protect, because those are the ones that can die very quickly from this. And you want to make sure the rest of us aren't vectors. We aren't spreading the virus to them. So it hasn't come to Colorado yet. Hopefully it won't. But we want to make sure we do our part, get vaccinated, because we're obviously traveling, come into contact with people every day.
Let's keep it that way. We don't know measles around these parts.
Dr. Kohli, thank you. You can find all of Dr. Kohli's appearances on 9news.com/Dr. Kohli.